a guy who when he started to go into mathematics, he devoured a calculus book in like a day and then did a 2-year course in about 3 weeks and aced all these differential equation things.
Wow.
Kind of things. He says that he's capable of learning things quickly, but he doesn't retain over long term. So he's a very smart guy, but he also knows that he has some weaknesses.
And so is he a very likable character?
I found him very personable. I mean, he clearly is very smart, he thinks very deeply, and is willing to take a different path both in life and sort of these difficult stances in standing up before doctors and telling them that they're all wrong.
And I'm sure they don't like hearing that.
He went through some interesting times where he talks about being attacked by a whole group of doctors for something that he has done.
What was that over?
He had, again, been startled that there wasn't evidence for a lot of things, and he looked at various things, and the critique was that he hadn't really looked at a treatment that had gone on long enough to acquire that degree of evidence. So he took something that had been around for 100 years, certain drugs used to treat high blood pressure in the eye, which can lead to glaucoma. And he went back and looked at all the studies he could find over decades and discovered that the studies actually suggested that the treatment might be harmful rather than helpful, and went to publish this. And, of course, all the ophthalmologists were horrified, and he talks about feeling like an outcast, really, and under the attacks of all these doctors.
I wonder what they think about his latest thinking. As you pointed out, he thinks that computer simulations using advanced mathematics can pretty much solve a good number of medicine's problems.
Well, the central problem he's trying to address is, how do we get evidence? And the gold standard is to do a clinical trial, but that takes years, costs millions of dollars, and often by the time you get the answer, it may be the technology in medicine may have moved on. And so his approach was, well, can we simulate a clinical trial and try out different treatments in this virtual world? Maybe we can arrive at an answer that we couldn't get through any other way.
And his system is called Archimedes, right?
That's what he has named his computer simulation, yes.
And how's he putting that into practice?
What the simulation does is it's a whole series of differential equations that tries to put in mathematics what is happening with actual biology. In other words, if you take diabetics, there are cells that stop making insulin, or the cells that become less sensitive to insulin, and then it causes all these effects. So you put all these equations into biology, and then you say, what if we simulate a drug treatment or a lifestyle change or something, anything that you want to test, and then you can put that into the simulation and come up with an answer.
Is it already working, or is this something that has promise that will really be fully developed in years ahead?
I think the jury is just still out on the ultimate impact, but it's already being put into practice. What he did first was to take a number of trials that had been done in the real world and put all the information from those about the patients in those trials and how they were treated into his simulation. And without even knowing the results of those clinical trials, the simulation came out with virtually identical results. So close that many people are just amazed at what they call in technical terms the validity of the model.
Mm-hmm. So, John, I know that like many of us, you've had some of your own bitter experiences with medicine. Can you tell us a little about that?
Well, my late wife was in a clinical trial with one of these drugs thought to be a sort of a miracle cancer drug, and the prognosis was terrible from the start because it was a very advanced cancer, but the drug had been touted by a lot of doctors and the press, too, as being this potential life-saving kind of thing. And as with many of these drugs that are held up as being, the great answer to cancer, it really didn't do anything. And the results of the larger clinical trial that we're in showed that at most it was an additional 1 or 2 months of life. And it's interesting how this was hailed by the medical system and by, again, the press as being a huge advance, that in fact a new cancer drug targeted in this way was brought a couple months of additional life. But I think to patients and their families, that's kind of a Pyrrhic victory.
Did your personal disappointment possibly shade your reporting?
I think actually what it has done is made me more skeptical, and I hope a good way, and not taking what the medical profession and doctors say as the last word, but in actually looking more closely at the studies and the evidence behind what these claims are. there's an interesting group of people up at Dartmouth that have done similar kind of things, looking at published papers and shown that in many cases the conclusions aren't borne out by the data. So scientists and doctors themselves who do this research are sort of subject to the same pressures of overhyping results, and I think my own experiences are helping me to identify those things better than I used to.
Hmm. I wonder how welcoming the doctors were during your reporting process. Did they resent you for asking these questions and challenging their treatments?
It's very interesting how most of the ones I talked to are and were reflective enough and sort of troubled enough themselves that they readily admit that evidence for a lot of this stuff is lacking. It doesn't mean that they don't believe in it anymore, but they do realize that a lot of what they're doing is not backed up by firm evidence. And that's one of the interesting things about Eddy is that Dr. Eddy that we were talking about is that he spent a number of years going to the societies, specialist societies of doctors, and that they didn't have much evidence for what they were doing. And at first he describes the reaction was very hostile, but now that it has really quite changed and people are more saying, yes, this is a problem and what should we do about it?
Hmm. Now, of course, in the story, you pretty much stay focused on Dr. Eddy and on a handful of diseases such as diabetes and cardiac care. But really, the problems you're describing are all through the healthcare system, I would think. And if you had all the space in the world, what else would you have told us about our broken healthcare system?
Well, I think the really bigger story, which we just touch on in a couple of places, are on the financial incentives in our healthcare system, which are often perverse, and that will pay the system for doing procedures and things where it might be better not to and prevent the problem in the first place, but people get paid for doing that. And so in some ways, we're set up because of these incentives to go down a wrong path.
Mm. Now, John, knowing what you know now, would you actually go into a hospital for heart surgery?
I think the take-home message from my reporting and from the story is that you can never be too well informed. And so there may be cases, and in fact there's like 3% of people who have very severe disease for which heart surgery is the right option. But you have to know all these risks and benefits, you have to know the condition you're in, and part of what we talk about in the story is how that information is beginning to get out, and that really does help patients.
John, let's pretend I'm Joe Average, and I go to my doctor and I find out that, in fact, my cholesterol levels are high, or he thinks my blood pressure is high, or there's just something that's confronting me. How do I go out and be an informed patient? And actually, obviously, I can't call up Dr. Eddy as you can and say, hey, this is a recommended treatment. What do you think? What can I do to inform myself to make a really important choice?
Yeah, for any of these big kind of treatments, there's an organization called the Foundation for Informed Decision Making, which has made its mission to take a lot of these things and gather all the evidence they can and then produce very understandable booklets and videotapes that describe exactly what is known, exactly what the risks are of each potential choice and what the benefits are. And that kind of thing, I think, is very helpful. I've talked to some health plans that offer this and some patients that have taken advantage of it. And what it does is it makes people feel so much more in charge of their health care. And, this old cliched term, empowered. But